Hello, I'm H.D. Chambers, Superintendent of Schools for Alief ISD. For those of you that watch these videos, I apologize because I know this week there have been multiple videos, so um, I'll try to keep this one really quick. I wanted just to come to you, share a little bit about COVID, and hopefully encourage everyone to stay safe and to continue practicing the behaviors that that's been instilled in us for the last 10 months. That is, wearing a mask, keeping appropriate social distance, and then obviously keeping our hands sanitized. We realize that the virus is continuing to impact us. We realize there are new variants of the virus out there. No one is 100% sure with any degree of accuracy that those various strains are in specific places. But nevertheless, I know it has a lot of us nervous and worried about ourselves and our family members, our friends, our loved ones that perhaps are most vulnerable to the virus. We also realize that the vaccine and the distribution of the vaccine has been frustrating, for lack of a better term. And I encourage you to keep working as hard as you can and keeping an eye on distribution sites and keeping your name out, in the queue if you're eligible. And we as a district will continue trying to make you aware of every opportunity there is for you to sign up or to sign family members up for the vaccine. I know that's important, and we are trying to do our best to be a good partner, not only with those distributing the vaccines, but with you and our community for receiving the vaccine. So just be aware we're attempting to share everything we know with you and keep you abreast of what we know. But it goes without saying, I want you to stay safe. I want you to take care of yourselves. We want, we as a school district have attempted since mid-September, September 15th, I believe, to be exact. We have attempted to keep a dashboard on our website as accurate and up to date as possible. I will be the first to admit, we will all admit that there are days and there are times where there is so much activity that either a day or two goes by that we don't get that dashboard updated. But please know our entire staff, who is dedicated to maintaining accurate and transparent information to staff and to students and to families, is doing everything in their power to keep information flowing, to keep data updated, and to share what our knowledge is and what we know with the appropriate staff and the appropriate community members. So for example, I want to reference our dashboard data. We have recently made an adjustment on one of the documents. So if you're familiar with it, you will know that we state we have a cumulative case total. In other words, cumulative meaning going all the way back to when we started keeping this information. It's an accumulated total. Doesn't mean they're all positive right now. It's just an accumulation of every accumulated case since September the 15th. And it's approaching 900 in our district. That does not mean we have 900 active positive cases in our district now. That does not mean that. It means that cumulatively, we've had 900 cases since September the 15th. And that's a combination of student positivity cases as well as staff positivity cases. So I asked our COVID response team to maybe adjust that so that those who might have been confused with cumulative versus current. So you will notice for those that look at that, you'll notice that we tried to explain that particular number refers to every case that we have been made aware of since September 15th. So you'll also notice that we keep up the dashboard with a weekly count or as up to date as we possibly can, and that number is all obviously significantly lower. Some weeks it's higher, some weeks it's lower, but it's obviously significantly lower than the cumulative case, and it's also included in the cumulative cases. So I just want to bring clarity to that so that no one there's no misinterpretation or misunderstanding about what that large number is. Obviously, we work all the time with positive cases and the contact tracing and how that impacts staffing on campuses as well as classes, and we continue to monitor that and to continue to use our medical experts and our best information we have from the world of science, and then obviously again those in the medical profession who are giving us guidance. Just please know that we're doing everything we can do to make decisions using that type of information, that type of data. It is very clear that the transmission of COVID is not an issue in schools, not only in our school district, but in schools in general. Our medical experts have tested that and have followed that and have tracked that and continue to tell us the problems that we're having in society, in our communities, both locally and regionally, as well as across the state of Texas, are behavior issues outside of the school walls. We're told constantly probably perhaps the safest place to be in terms of preventing COVID from being spread in our schools. And I know some of you may not believe that. Some of you may have a hard time believing that. But don't believe what I'm telling you. That's what our medical professionals and experts are saying. And if you have not had a chance to listen to last week's Impact Ed podcast episodes, I sat down and visited with Dr. Maria Rivera, a physician with the Harris County Public Health. And then I talked to Dr. David Callender, who's the CEO of the Memorial Hermann Hospital System. And we addressed the issue of schools and the degree of risk of the transmission of COVID in our schools, not just our schools, but schools in general. And they were very clear. They were very clear that we're the institutions of schools, because we're doing such a really good job. You are doing such a really good job of monitoring and making sure that both staff and students are preparing and are practicing safe, healthy standards. That's the reason. So I know wearing a mask is bothersome. I know social distancing is bothersome. I know that constantly washing your hands is bothersome, but I respectfully request that we all continue doing that for the good of the greater good, regardless of what your own positions are or your own opinions are. This is something I'm asking that we all do for each other and for our students, our staff, our colleagues, and our community. So this weekend is Super Bowl weekend. Do I have to say anything? Really, do I have to say anything? Please be smart. Please be smart. If you're going to get together with friends, wear a mask. And I know some of you may be chuckling as I'm saying this, or rolling your eyes, one of the two. But be smart. The medical field, the Center for Disease Control, all the physicians that you hear on television, both nationally and locally, are saying what makes them really worried about Super Bowl weekend or Super Bowl Sunday is that it is a 5 or 6 hour event, meaning, and we've all been to Super Bowl parties, it's not just an hour or so and you go home. It's an all-day ordeal in some cases, and it's an indoors event. So just take care of yourselves, please. Be a good example for your kids. Thank you. God bless you. Take care of yourselves, and we will talk soon.